Why do people hate femoral lines so much? Before we talk about it, I just need to address the dressing situation here. I'm gonna have a stroke, okay? But let's talk about it. Femoral lines can be venous or arterial depending on the type of line that is placed, and typically they are only placed either in emergency situations or when a patient has no other good access point. If you've cared for a patient with a femoral line, a lot of times you are being pushed to let's get it out, let's get it out, let's get it out. Let's get that patient another type of central line or another type of arterial line so that way we can remove the lines from the groin. And the reason why is because groin lines have a much higher infection risk. One, just based off of the location, the groin is a much dirtier site, more risk for contamination from urine or feces. The dressing is much more likely to get compromised, especially if your patient is mobile or we're turning our patients a lot. Sometimes these lines are placed under emergent situations, and while yes, there are protocols for this, whenever there is an emergency, like if this is placed during a code, it is not going to be under the same amazing sterile conditions as a line that is placed when it's like not an emergency. So all these factors looped in cause these lines to be much higher infection risk, which is why we want to get them out right away. Now, sometimes the patient truly does not have another option. This patient, anatomy wise, or they've maybe had multiple lines, or they have existing comorbidities that make their vascular access points very difficult. The femoral vein and artery is just a much bigger vessel in general. And so it's much easier to access. It also typically we're not accessing patients' groins very much. And so these are usually fresh spots. But the goal is always going to be to get it out, get those lines moved to a different spot.